Hello everyone, welcome to KHA Homeopathy Study Group Pro Bono Webinar. Good morning, good afternoon and good evening. So nice to see many of you from different countries and different time zones. Before we start, we would thank Universe for giving us this great opportunity with Gayatri Mantra chanted by Professor Regina from Brazil, followed by Dr. Sweta.
Om Bhuvat Swaha Tat Saviturvarenyan Devasya Jima.
Thank you.
Jio Yona Prachodaya.
Thank you, Professor Regina. And Dr. Sweta will introduce about KHA study group.
Thank you so much, ma'am. It's my privilege to introduce KHA Homeopathy Study Group to all of you. And the KHA Homeopathy Study Group Pro Bono was organized and founded by homeopath and humanitarian Kavita Kukunur, President and CEO of Kavita Holistic Approach. This study group is intended to be an offering from Kavita to the homeopaths around the globe, sharing and goodwill and solid clinical work within the classical model. Our foundation principles for the KHA mission and vision are very unique to inspire young homeopaths, mentor, provide excellency for educational purposes using holistic approaches via webinars, which are based on principles of classical homeopathy, and provide professional continuing educational homeopathic credits for practitioners. We provide merit certificates for spreading the light of homeopathy around the globe, while celebrating stage 4 cancer survivors through our inspirational book talks. Dr. Kavita is a member of Kevin Friendly Foundation, a non-profit organization that helps to serve poor people in greater needs in India. She is the recipient of Martha Ullman Community Service Award by National Center for Homeopathy and Best Entrepreneur Award from Dr. N. Lingaraju, Principal of JSPS Homeopathic Medical College, Hyderabad, India. We are extremely happy and proud that we celebrated 10 years of her book, Beyond the Limits, a challenge to prove oneself. This precious writing contains her true life experiences, where she connected to homeopathic principle with inspirational stories, where she converted her obstacles and struggles as stepping stones for her success in America, and her passion and devotion towards life and homeopathic profession, dedicated to all proud women. As of now, we have over 180 recordings on professional webinars related to homeopathy, health-related topics, and inspirational talks. This webinar is moderated by KHA family, myself, Dr. Shweta Singh, Chief Administrator, and Professor Regina Renelli. It is being recorded as we speak, and we are live on Facebook. We will take questions at the end of the webinar. We will post a jot form in a Zoom webinar chat at the end of webinar. Please fill the form. To receive certificate, if you are watching live webinar, email us at kstudygroup@gmail.com, and please mute yourself to avoid any interruption. And thank you so much, Dr. Kavita. Over to you.
Thank you so much, Dr. Sweta. And I thank KHA Homeopathy Study Group entire team for the continuous support, and with which we are able to make our pro bono activities and webinars so beautiful. These webinars are for educational purposes only and see an expert homeopath for treatment. Being an outreach coordinator of CHCPR committee and HNA CPD provider, we encourage homeopaths to become CHC certified and to participate in HNA accredited webinars. A quick announcement. Mission 5000 by Dr. Jawhar Shah and Enlightenment Education. Do not miss this great opportunity of enlightening webinar series with the renowned over 90 speakers and 108 enlightening sessions. And many recordings and gifts are available. We have many KHA volunteers as speakers. To name few, Dr. Girish Gupta, Dr. Yashika, including myself, and many more speakers. And today's speaker, Robin Pollock, has been a speaker at there. To register and for more details, visit onlinehomeopathycourse.com. Today, August 21st, we have our two honorable speakers, Robin Pollock and Dr. Yudhishthir Singh, President of DHMA, with very interesting topic, Sink Your Teeth into Homeopathy for Dental Issues. We have many homeopathic remedies that address several dental issues, and today we learn and explore from our speaker, Robin, and also about introduction about DHMA. We planned this session for 1 hour 45 minutes up to 2 hours. Let me introduce our two honorable speakers for today's webinar. Robin Pollock is a well-known homeopathic practitioner from Canada. She is honors graduate and fellow of Canadian College of Homeopathic Medicine and a registered member of College of Homeopaths of Ontario and North American Society of Homeopaths. She is a board member of for Homeopathic Canada and North American Society of Homeopaths. Robin is the center of Mastering Mathematica, an upcoming online tool to study comparative mathematica in the manner outlined by Constantine Herring. She has published several articles in the American Homeopath, has one upcoming in August in Homeopathy, and taught seminars and webinars on both philosophical and clinical topics. She has many years of experience moderating webinars with Whole Health Now and for Homeopathic Canada, and is a contributor of Homeopathy House Call. Before switching careers, Robin was extensively trained in and practiced clinical group and concentrating on her thesis. She's also a ranked Scramble Master and international tournament commentator and analyst. And our second speaker, Dr. Yudhishthir Singh, President of DHMA. But due to family occasion, Dr. Yudhishthir Singh could not make it for the webinar. So, Dr. Deepak Sharma, General Secretary of DHMA, will be representing on behalf of him. Few words about Dr. Deepak Sharma. He is General Secretary of DHMA, founder and director of Orbit Clinic. He is an international speaker, Chair WHO Netherlands, life member of Liga, SDHA, and General Secretary of Mata Annapurna Mandir Samiti. He is associated with KHA as Senior Consultant since 2013. And about Delhi Homeopathic Medical Association, DHMA is the oldest and mother association of homeopathy in Delhi, which is established in 1932 by Dr. Yudhishthir Singh, dedicated to promote, represent, and serve homeopathy. And it is becoming the voice of all professional homeopaths around the world, doing several webinars integrating homeopaths internationally. I was delighted to be part of DHMA CME and delivered lecture on homeoprophylaxis on behalf of International World Homeoprophylaxis Week in August 2017 at Delhi. And our KHA Chief Administrator, Dr. Sweta Singh, is Vice President of DHMA. We also have our KHA volunteer, Dr. Nupur Shah, part of DHMA. This time, we are doing little different. First 10 to 15 minutes, we would go with our second speaker, followed by our main speaker. Let us welcome our honorable speaker, Dr. Deepak Sharma, to our webinar.
Thank you, Dr. Kavita, and thank you, Professor Regina. Thank you so much for all team of KHA. And I am also a team member of KHA. I am proud of that. And you are, this is really appreciating that you are including the introduction of DHMA in this webinar. So I am representing as a General Secretary of Delhi Homeopathic Medical Association on behalf of our president. And this is our main slide. The first slide, we are starting with the KHA webinar today with Robin Pollock. So good luck to Robin Pollock for her webinar. So I am telling about you about the Delhi Homeopathic Medical Association. This is our the emblem of Delhi Homeopathic Medical Association, and our website is www.dhma.in. As Dr. Kavita said, it was founded by Dr. Yudhishthir Singh, who was born in 1897 and died in 1983. He was the first health minister of Delhi government. He was a perfect homeopath. He also founded Nehru Homeopathic Medical College in Delhi, and many homeopathic dispensaries which are already run by many charitables, run by societies currently in Delhi. So, and also he is a founder of Delhi Public Library. This is also a place where Delhi Homeopathic Medical Association is always doing the regular CMEs and our programs. But due to COVID, we are just switch off our DPL programs, and we are coming to the online areas. So this is a short summary about DHMA. There is a 89 years and still continue with same organization, the same name. It is government registered associations, and documents said that it was registered in 1932, but Dr. Yudhishthir gave a name in 1928. So it was registered about 4 and 5 years after the name given, but still we are continuing with the CMEs, the Continuing Medical Education Series, on every last Sunday of the month in DPL. DPL means Delhi Public Library in Delhi. We are doing health camps very regularly. We are doing research works, student supports, and many government projects are there. DHMA in 2021. Now in DHMA is having the organization which is having the main post is the president, and the president is elected by the election biannually. So in 2020, Dr. Yudhishthir Singh was elected as president, and every president who elected in the election is selecting their own team. So in 2020, 20 and 21, we are having 17 executive members, 265 registered homeopaths, more than 160 students are there, more than 100 associates members. Associate members means those are not registered with the homeopathic organization or the homeopathic universities, but they are loving the homeopathy. So we are not encouraging the people only for the doctors, but we are also encouraging the people who are loving the homeopathy or homeopaths. So this is called the associate member, and there is 9 life members in 2021. We are promoting research work, especially for COVID and post-COVID cases in 2021, and we will publish it very soon. And there is a very fantastic work we are doing with team. In 2020, we starting the first webinar in Delhi after the first lockdown, and till then we are doing the 85 webinars of more than 250 hours and 2 webinar series since 2018 of March of 2020. We are also going to publish Hanimanian Shandesh, that is also was published offline in a printed media, but we are going to publish the Hanimanian Shandesh. Hanimanian Shandesh means a message from the Dr. Haniman. This will be online very soon, and this will include the peer-reviewed articles only. We are having the many association with international organization. We are planning to health camp in developing countries in 2020 and 22. So till today, Delhi Homeopathic Medical Association is just limited to Delhi, but after COVID, we are spreading worldwide, and we are now planning to do many health camps and many activities within the country or the associate developing countries with India. It associates with many international organizations, I already told. Now, everyone, why you want to join DHMA? There are more than 300 peer-reviewed articles will be soon be available for members on our website. DHMA members can join WhatsApp and Telegram group, and this is especially for the members, where we are discussing many cases, many literatures, those you cannot find on the common groups. Case discussions with senior homeopaths, opportunity to meet with stalwarts, free joining in every activity of DHMA. You publish your article or blog on priority basis, connect to international homepages in just a click. This is all about our DHMA website. For any query, ask me. I am Dr. Deepak Sharma, General Secretary of Delhi Homeopathic Medical Association. I again really thankful to Dr. Kavita and to joining DHMA. Right, just go to the website www.dhma.in or email us dhmadelhi@gmail.com or WhatsApp or Telegram at 9711153617. So thank you, Dr. Kavita, for giving opportunity to explore the DHMA at your webinar. Thank you so much.
Thank you, Dr. Deepak. That was very nice, and I really encourage everyone to be part of DHMA and share their knowledge. And without further delay, we would welcome our honorable speaker, Robin, to our webinar.
Hi, everybody. I'm going to just share my screen. Desktop, share, there we go. And I'm going to put this into, okay. Can everybody see my screen? Good? Talking into an abyss whenever you do a webinar. Okay, so hi, everybody. Let me go on to the next slide. There we go. So my name is Robin Pollock, and I was given a very long introduction, so I'm not going to go further than that. But I will say that repeat what Dr. Kavita said in the past, my past career was as a psychologist, and I tend to give webinars on psychiatric topics. And then I said, well, you know what, I'd like to do something more clinical. And let's do something that you don't necessarily get a lot of training in. I know I didn't get it until I did a fellowship year, and then I took a 13-hour course on dentistry as well. So I thought for a lot of homeopaths, we don't really learn a lot about dentistry, number one. And number two, I was really interested to understand the psychological components about acute and chronic care in dentistry. So I thought I would delve into it, and I'm going to give you my webinar today on that. Okay, so no shortage of memes online about going to the dentist. We all know that, you know, if we ask our children, do you want to go to Disney World or do you want to go to the dentist? I think we have a pretty easy choice about what they want to do. So it can be, you know, it could be frightening, it could be unpleasant, or it could be annoying. But it could also be a very traumatizing event, and, you know, for good reason. You know, the tooth is the only tissue in the body that's capable of feeling pain only. It has no pleasant sensations whatsoever. And also our experience of going to the dentist, right? We hear the sound of the drill all the time, and the smell. You know what? I have to turn off this. There we go. There we go. The smell that we're getting. Well, when we realize, my God, that's my tooth that I'm smelling that's being drilled into. So it's not a very pleasant experience for most people. But going to the dentist, as we all know, is a very, very vital part about our healthcare regimen, right? We have to go at least once a year for a full checkup. We should go twice a year for teeth cleaning, because it not only maintains the health of your oral cavity, but of your entire body, because the mouth is one large gateway inside of you. And other illnesses can occur if you don't take care of your teeth and gums. So before I start, my son said to me, you're giving a talk on dentistry. I know one dentistry joke, so I'm going to say it. I can't see anybody's reaction, but I'm going to give it. What's the best time of day to go to the dentist? Think about it. What time of day is the best? 2:30. Tooth hurty. 2:30. Okay, that's my one joke about going to the dentist. Let's move on. All right. So where does homeopathy fit in dentistry? Okay. For the most part, homeopathy is a highly useful adjunct to traditional dental care. It's not intended as a replacement or alternative. Just like if you were to cut off your finger, you wouldn't use homeopathy to put it back together. You would need a surgical intervention. Very often in dentistry, you need a surgical intervention, and homeopathy cannot replace it, okay? But it could serve as an important adjunct before, during, and after. Now, dental issues can be both chronic, used in chronic and acute conditions, okay? For eliminating the need for antibiotics, reducing pain, inflammation, and scarring. It could speed healing after an injury and repair the vital forces disharmony that leads to things like dental caries and tooth discoloration. So let's look at some of the acute situations that dentistry addresses. Okay, there we go. Sudden toothaches, injury, bruising, fracture, pre and post-surgery management of pain, bleeding, inflammation, abscess, and scar formation, procedure anxiety, we'll talk about the mental emotionals, and of course, tooth fairy disappointment, dental caries in the chronic situations, delayed tooth eruption, lichen planus, recurrent infection, bruxism, oral candidiasis, gingivitis, and periodontitis. And these are just some of the ones, and I'll be covering some of these today. So as homeopaths, what is it that we need to consider when we are taking the case in a dental situation? Is it the same as when we take our normal cases? Well, as always, we have to consider the etiology. So for example, if the dental pain is due to an obvious injury, we can give something like arnica to reduce the inflammation and bruising. That's obvious. But if there's an underlying abscess that is causing the dental pain, it's not enough just to treat the pain symptoms, because the abscess must be treated and cured as well. So always we have to consider modalities, no question there. We really need to understand what makes the condition better or worse and not be fooled or to misinterpret, because we are really not spending 2 hours with our patients. Some of us take interviews like that. We're seeing them in a much quicker situation, especially if you're a dentist. You really need to make sure that the modalities that you're getting actually match what's going on. So for example, a patient might say that, let's say that they're better lying down, better lying on the painful side. So the question really is the patient really better lying down, or is it better because they're putting pressure on the side that's hurting? So you really need to dig deeper and find out what that modality means. Another example would be, for example, better motion. So is it because moving actually makes them feel better, or is it because there's this underlying restlessness, that is, there's restlessness with the pain, in which case they need to keep moving? So this will help you to pick out the correct rubric. Now, bear in mind that many patients will be on painkillers when they come to see you, and so the true symptom picture will be muddied and the true modalities may not be very clear. So finding those rare, strange, and peculiars, or the PQRS, as some of you call it, it becomes very difficult in this situation. As always, we need to look at the mental emotional state. Now, just as Hahnemann tells us, my favorite footnote, the footnote to 213, that, for example, aconite will never cure if the person is calm. We need to determine the patient's mental and emotional state, and more importantly, changes in usual behavior during the episode to help us find the most appropriate remedy. And then we actually have to look at the state of the tissue. Is the tissue still healthy, vital, and alive? Or is it inflamed or possibly even dead? So for example, and you're going to hear me say this a bunch of times throughout this talk because it's an important one, hypericum and belladonna are indicated when the tissue is inflamed and the nerve is still alive. So it's indicated for alive, vital tissue, okay? But if you have dead tissue, okay, you have an abscess, the tooth has died, the root has died, then belladonna and hypericum are no longer going to work. Okay, so you have to think to something like silica if the pain is throbbing, or to hepar sulf if the pain is not throbbing, and that's if the tissue has lost its vitality. So vitality of the nerve is as important to ascertain as the vitality of the patient. So maybe, okay, I've already said that. So finally, if you can't get a clear picture of the remedy based on all of these, then what you want to do is go to the generals, okay? And you want to look, what is the general state of the patient and how has that changed in the current situation? That will help you narrow down the remedy. All right, so here is a bit of a schedule of what we're going to cover today. I promise I'm trying to get this in an hour and 45. I'll tell you the truth, this whole talk is 2 hours and 30 minutes and I desperately edited it down yesterday. I'm going to do my best. I apologize if I talk a little quickly, and sometimes I will ask you to take screenshots because there just isn't time, and I made the decision I'd rather give you the screen that you can take a picture of rather than deprive you of the information that might be helpful to you. So forgive me for that. I tend to over give, but we do have limited time today. All right, so let's look at the tooth anatomy. And I did have a whole section on the, the embryological development of the tooth, that you can read that on your own, but I would not cut out tooth anatomy because it is so important. If we know exactly all of the different layers of the teeth, we're going to suddenly really understand all of the different dental disorders that I'm going to be talking about today. Okay, and it's also not just the actual parts of the tooth that's important, it's also the relationships. We need to understand where each layer is in relation to the other so that we can understand the process that's going on, okay? So teeth are the hardest substances in the body, What are their function? Well, the obvious one is we use it for chewing, but they also play an important role in speech, right? They allow for proper pronunciation of words. You think of somebody who has lost their teeth and they're kind of gumming their words. So they're very important for speech. And they also help to maintain the shape and structure of the jaw. So let's look over here first. I think you can see my pointer. So this part here is the crown. It is the part that sticks up above the gingiva, above the gum, okay? And it's exposed and it is covered with enamel. Now this is the root of the tooth here below, and that is the part that goes below the gum. And it's divided and it goes in either into the lower jawbone, but remember we also have teeth that go up into the maxilla. So they go both ways, but one is upside down from the other. Okay, they anchor the tooth in the bone, in the mouth. Now this neck is this little dividing place in between the gum line where the crown meets the root. So let's look a little bit more into the specific tissue. So we're going to understand when we talk about caries, when we talk about abscess, we're going to understand what's going on. So here is the enamel. It's the white covering you could see on the surface of the tooth's crown. It's the hardest substance in the body. There's your trivia answer for the day. It's the hardest substance in the body. It's even harder than bone, and it's made of crystalline calcium phosphate. Now, enamel is the only tissue in the body that has no living cells. That's your second trivia question of the day. So it is not alive. And because it is not alive, it cannot repair itself after decay or damage. And as we know, as dynamic medical people, that if something is not alive, that homeopathy with its dynamic medicines isn't going to do a lot over there. So damage occurs from what? From acid secreted by oral bacteria, which can erode the enamel. Now below it, we have the dentin. So I'm going to trace it all the way around for you over there. So it's a layer right underneath the enamel, and it's the major component of the tooth, extending almost the entire length of the tooth. And it's also a hard tissue, but it's not as hard as enamel, okay? And the enamel does protect it from above. And then we're going to talk about the cementum, which is this brown over here. So it protects it around it. So the enamel on top protects it, cementum below protects it. The dentin contains small nerve endings that warn you when decay or other irritants have penetrated the tooth's outer layer of enamel, okay? Because it's a living tissue and it has a similar structure to bone. It's elastic, it's compressible, and it contains microscopic tubes. If the enamel above here gets damaged, heat or cold can enter the tooth through these tubes and they can cause sensitivity or pain. So that's where the pain starts, okay? Because the dentin is softer than the enamel, once bacteria do enter it, they can reach the underlying pulp cavity, and that's the heart and soul of the tooth. So this is the pulp cavity, just that whole area that is red. Okay, and it's softer and it's the living innermost portion of the tooth, and it holds the pulp, which is made up of, you can see all the different colors, blue, red, and yellow, blood vessels, which of course supply blood and nutrients to the tooth to keep it alive, and nerves run through the pulp and they sense temperature. Lymph vessels carrying white blood cells to the cell are there to help fight bacteria. So this is the heart and soul of the tooth, and this is where infection can occur. The tissue becomes engorged in blood and can lead to abscess formation and death of the pulp tissue. Now, once this pulp tissue becomes infected, it cannot heal on its own, okay? Because where is it going to go? It can't get out. It is the hardest tissue in the body. The only place for it to go is down, and it goes through the root tips, which we'll talk about in a second, and into where? The bone. Okay, the cementum is what I mentioned before over here, and it is a hard connective tissue layer. It attaches to the periodontal ligament, which is this pink W-shaped structure over here, and it binds the roof of the teeth to the gums and or to the jaw, which is called the alveolar bone. Now, the periodontal ligament, which I said is this W-shaped over here, it's made up of bundles of connective tissue fibers connected to the cementum and to the tooth root. Now, it senses pain and if food is stuck between the teeth. So every time you feel food stuck between your teeth, it's your periodontal ligament saying, hey, notice me, clean me up. Now, the fibers in the ligament act as shock absorbers, allowing the tooth to withstand the forces of biting and chewing. And it's also the periodontal ligament that allows the tooth to move when you are having braces put on and you want to have the teeth move to the desired location. It's the ligament that allows you to have that mobility. Now, the root canal, which we talked about in this pulp cavity, is that open space and it extends throughout. And that's where the blood vessels and nerves and the lymph are. And then they go through, how do they get into the body? They go through at the tip of the tooth is called the apex. Okay, it's the apical foramen that which is all of 22 millimeters wide. And that's where everything goes through. So it helps bring nutrients in from the body and to spread it to the tooth. Now, the front teeth have 1 root and the back teeth have 2, and the molars and wisdom teeth have 4 of these roots. And then we have finally the alveolar bone. So that's the jawbone on top, and it supports the roots of each teeth, and it contains tooth sockets into which the teeth embeds itself. So there is your anatomy in a nutshell. So think about it as we talk about all the conditions. We're going to be thinking about all the different parts of the tooth. All right, so the first thing we're going to talk about today is dentition, which is an important one, especially for our little babies that we're taking care of, and then our adolescents as well. So there are 2 different kinds of dentition, okay? There are primary teeth, and they differ from the permanent teeth in that the primary teeth are smaller, have more pointed cusps, and are whiter in color. So let's look at primary and deciduous, are also known as deciduous. Okay, these are the teeth that first form in the womb. So if you do go and look at the embryological development of the teeth, you'll see that teeth actually start to develop from the mesoderm, right? The endoderm, mesoderm, ectoderm. It develops from the mesoderm, which is the bone and the connective tissue. And it starts developing as early as the 6th and 7th week of embryonic life. But they start to erupt between 6 and 12 months. They consist of a full set of 20 teeth by the age of 3, which later shed over time, ending by around age 13. Now, what happens? Why do we need 2 sets of teeth? Well, our face and our jaw don't remain, and our skull don't remain the same shape as we're getting older. Of course, everything is growing. So as the jaw gets bigger, it can accommodate more teeth, and it can accommodate bigger teeth. And because our diet is becoming, for a lot of people with meat, for example, they're going to need bigger teeth in order to do all that crushing and grinding. So that's why we develop a second set of teeth called the permanent teeth. And that occurs as the primary teeth are shed about ages 6 to 12, and the jaw grows and matures, and you get up to 32 teeth erupt and replace the primary dentition. And the reason I say up to is that because we have far too many teeth than our jaw can accommodate for the most part, and we all have heard of impacted wisdom teeth. So sometimes those teeth have absolutely nowhere to come out. So very often they will have to be removed surgically. So for homeopaths, of course, we're interested in dentition because we want to know whether all of the dentition milestones are met. Do we have early dentition? Do we have normal dentition? Or do we have late dentition? And if the first eruption doesn't occur, for example, until after 12 months, that's a symptom we need to make note of. Now, this is what the teeth look like. Just very quickly, on the left, we see the deciduous teeth, so the smaller jaw, and here we have the permanent teeth. The difference between the deciduous, the 32, the 12 different teeth is because in the adult set, we have 8 molars and 4 wisdom teeth. Now this, unfortunately, is the skull of an 8-year-old, but it's very elucidating because it can show you the teeth below the gum line that are meant to erupt after these deciduous teeth are ready to fall out. So they're all sitting there waiting to come in. So there's a fascinating picture. Okay, so let's just look very quickly at the different kinds of teeth so that you're more familiar, and just in case you aren't. These are the incisors. So the first 4, if you look over here in the purple, the first 4 in the front of your, on the top and the bottom, and they're used for biting, cutting, tearing, and holding pieces of food. The other next kind of teeth are those canines, sometimes called the eye teeth, okay, and they hold and tear food apart. And then we have 2 different kinds of molars. Here are the premolars, and these are the molars. Okay, and they hold and they crush food, and for the molars, and molars crush and grind food. Okay, so the premolars generally have 2 cusps, and that's why they're called bicuspids. That's another name for them. And then, as you can see, the number of roots 1, 2, and here 3, or even 4. The number of roots each tooth varies according to the tooth type. All right, so let's look at our first homeopathic condition, which is a situation where there is dentition slow. And I remember when I was studying homeopathy, I never really understood the difference between dentition slow and dentition difficult, but don't confuse it. Okay, dentition difficult is used when there is painful symptoms associated with dentition, or the behaviors around teething. For example, if there's biting with the dentition or shrieking during teething, or there could be physical concomitants during teething, such as convulsions. So that's dentition difficult. Difficult dentition has nothing to do with the time component, which is dentition slow. In other words, when the teeth come in. So as you can see, and not surprisingly, look at the blue, 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 blue. That means mineral. Primary remedies are calc carb, calc phos, silica, fluoricum acidum, because there's a lot of destruction over there. And they can be given individually and according to the totality of symptoms. It's recommended to, I'll try to give you posology as much as I can based on all the reading I've done. In this case, it was recommended 6 to 12C twice a day would be good for dentition slow. So let's have a look at some of the remedies associated. I like to do a comparative materia medica. I think you heard Dr. Kavitha mention that I'm writing an app that actually follows the teachings of Constantine Herring on the study of materia medica for his 1837 essay, which I found fascinating, that you take one remedy, you take another remedy, you put them side by side, and then you compare them for very similar rubrics. And this way you really get a sense of the two remedies and how one is indicated in certain patients and another one is indicated in others. So this particular materia medica comes from Borland, who is a well-known author on children and homeopathy. And since we're doing dentition slow, we want to look to an author who has a lot of experience with children. So let's look at their rubrics side by side and see how they compare and how we could learn to teasel out when one might be appropriate and when the other one would be. I'm pressing the wrong thing. Thank you. So silica children, now we don't always go by the physiognomy of the person, but this is well established with silica that they tend to be thin, underweight, fine boned. So how does fluoricum acidum compare? Well, also small, fine boned, and they can be slim, but they aren't necessarily slim. Silica tends to have a yielding disposition, and then so does fluoricum acidum. So far, we have no way to differentiate them. Silica can be irritable, but on the other hand, fluoricum acidum is a patient with an enjoyment of life. But on the other hand, for some reason, it's been found that they can have hatred of individuals at school. So not the same thing as irritable. They can be easily tired by mental concentration, and lo and behold, so can fluoricum acidum. They are worse physical exertion and worse standing any length of time. Fluoricum acidum, on the other hand, are ameliorated by physical exertion, but like silica, standing any length of time also tends to tire them out. They tend to have a poor appetite. Now, here's the big difference. Fluoricum acidum has a tremendous appetite. They have even hunger headaches. And it's been observed that fluoricum acidum children will often need extra food at school in the middle of the morning, or they'll develop a headache. They can wake up hungry in the middle of the night and they're unable to sleep unless they have something to eat. So despite all that extra food, however, remember they said we can be slim. They still tend to be fairly slim, although many are decidedly not underweight. Silica is better in a warm room. Fluoricum acidum is worse in a warm room. Silica tends to have fine hair, and fine hair also in fluoricum acidum, but with patchy thin areas. So in general, a little bit more information on dentition in fluoricum acidum. They can have very faulty dentition with poor enamel of the teeth and tendency for the teeth to decay early as well. And that's not surprising. We're seeing an acid remedy, which can be quite destructive, corrosive, syphilitic. They very often will have abscesses at the roots of the teeth. And we're going to note when we look at abscesses that there are different locations where the abscesses can be to help you differentiate with the remedies. And this poor dentition is also associated with unhealthy fingernails, which are brittle, cracked, and splintered. So all of the mineralization within the fluoricum acidum tends to be a little off. So very important also to always check things like the keratinization of your patients, including their fingernails. All right, so as I said, I had to rush through cutting through some stuff. So I'm not going to go through some of the differentiating symptoms of some of these other remedies. So I recommend that right now you take a screenshot if you are interested in this. But I will just mention to you that Periapical was not in my original repertorization of the chart. And I just wanted to point out to you that not in every repertory is every remedy that actually has for example, dentition slow. Okay, it was not in my list. I found it in Borland when I did a Materia Medica search. So it's very useful to go into the Materia Medica to see what other remedies come up for the specific rubric that you're doing, just in case it's not in the repertory you were using. And it's also a very good reminder to use as many repertories as you can. If you're not finding something, it does make sense, given the slow assimilation of boritic carb, that it should have dentition slow. And if it's not in your repertory, maybe look in the other repertories in your software to see if you can find it. Now, I couldn't find it in any of mine, but I found it in the Materia Medica of Borland at the very least, who's an author on pediatrics. So I felt it was a robust symptom for boritic carb. All right, so now let's move on to, I think we're only doing questions at the end. I can't see anything right now because my screen's in full mode. So if there are questions that anybody wants to interrupt, please, you're gonna have to just do it verbally because I can't see anybody, just to let you know. So let's go on to dental caries. Now, why is it important to deal with cavities as soon as they appear? Why can't we just let them, fester for a little bit? So over time, the cavity will enlarge and the enamel does crumble. Remember, the enamel, the hardest substance in the body. If you've got something that's able of penetrating the hardest substance in the body, you better take notice of it. You better, pay attention that this is, if it can do that to the enamel, imagine what it's going to do to the rest of your body. So as the cavity enlarges, over time, it eventually works its way into the pulp cavity, which is exactly where you don't want it to go, because that is the most alive tissue in your teeth. That's where the blood supply, the nerves, the lymphatics are, and this is where the infection occurs, and the tooth may either pop an abscess or worse, it may die. And once that tooth is dead, nothing, not even Lazarus, can bring it back. Now, this causes pain. So that's not good for the patient, but it's good for us because there will be modalities associated with that pain. So it will help us narrow down the remedy. Okay, but I just want to stress to you again the importance that once we get to the point where the tooth is dying, homeopathy cannot help any further. Okay, this is something that I learned by studying this webinar in terms of dynamic tissue, right? The process cannot be reversed because the blood supply to the nerve area disappears. And this is how it works. Okay, the inflammation builds up and there is nowhere for that pressure to go because of that crown with the enamel. There's nowhere for it to dissipate. If you get a bruise, for example, right, you get an ecchymosis. Well, the blood can dissipate throughout the muscle and it could spread out and it cannot concentrate in one area. But with a tooth, it has nowhere to go but deeper into the pulp and then out through those apices at the bottom and then into the alveolar bone and then into the body through the bloodstream. So eventually the blood supply will be cut off, and that results in necrosis of the tissue, unfortunately. And there is nothing that can be done about it, not even homeopathically. Okay, so what are some of the causes of dental caries? So this is important for our discussions about lifestyle with our parents, but one with our patients. But one thing I found very interesting, I read, is that if a tooth does not get a cavity by the age of 13 or 14, it's thought that it has a great likelihood of never getting a cavity for the life of the person. It's interesting. So a very good reason to make sure, certainly when the permanent teeth come in, to have very, very good dental hygiene. We talked about bacteria because what does bacteria do? It secretes acid that can dissolve teeth. And what do these bacteria thrive on? Sugars and refined foods. So that's why your dentist is always telling you, don't eat sugar. And sugar is everywhere. It's in everything. It's in your salad dressings. It's in places where you wouldn't believe. Okay, improper mouth hygiene, of course, brushing and flossing, you need to do that. Yes, your hygienist asked you floss after every meal, and we all go sheepishly, yes. And then he or she looks at you and knows that you're lying. It's very, very important to floss. Okay, the bacteria are allowed to thrive and they bind with waste products in the mouth and they form plaque. And that can erode the tooth enamel and enter into the dentin. And then there are actually overall health problems can have an effect on creating dental caries, and certainly has a great effect on your gums as well. But we're talking about teeth today, so I'll just leave it at that. Sex hormones, for example, imbalances can lead to gum and teeth problems. So you might have noticed in your patients who are reaching puberty, starting menses, going through pregnancy, going through the climacteric, there often tend to be teeth and gum issues around that time. This is why. Also, stress can have an effect on the connective tissue. So let's have a look at, these are all of the remedies that are associated with premature in children and rapid caries, which I'm going to kind of be, I thought they seemed like, are they the child and the adult version of the same thing? And they kind of are, because when you look at all of the remedies, you see the first 9 ones for sure, they completely match each other. So these are obviously very important remedies for both situations. So let's do another comparative materia medica. I've already done fluoricum acidum already, so I'm not going to repeat it. But also in Fatok's repertory, he only mentions 3 remedies for premature caries in children. He mentions creosotum, Staphysagria, and calc phos. And creosotum and Staphysagria are the highest graded ones over the calc phos. So let's have a look at a comparative materia medica of creosotum and Staphysagria, because there's a good chance that you're going to be doing a comparative between these 2. All right, so creosotum, children are old and looking wrinkled, but in Staphysagria, they tend to be pot-bellied children. And we all know Staphysagria has many, many presentations emotionally and otherwise. So again, take the physiognomy with a grain of salt. They are scrofulous or psoric with rapid emaciation. They can be irritable and restless, and their pale can be face and sour smell. Whereas Staphysagria also has that scrofulous syphilitic children, worn, weak, broken down, kind of. So kind of similar so far. They are worse dentition. Staphysagria as well, during dentition, very sensitive to mental or physical impressions. They cry from the least pain. So both suffer, both have a difficult dentition. Now this is, excuse me, a beautiful rubric that will help you differentiate between the 2 remedies. With creosotum, there's a tendency for the teeth first to become yellow, and then they get dark, and then they decay. But in Staphysagria, I'll tell you in a second, the tooth begin to decay in the enamel. This is the location. So I'm giving you the color and the location. Tooth begin to decay in the enamel and transversely next to and parallel to the gums. And Staphysagria, by comparison, the teeth turn black and they crumble as soon as they appear, and the crown decays. In creosotum, where's the location of the pain? It extends from the teeth to the left side of the face. There's burning and there's worse motion and talking. Whereas Staphysagria, the intolerable pain in the decaying teeth, extending through all the teeth, into the roots, to the eyes, to the ears, to the face, to the jaws and the head. Okay, so we have a different extension of the pain. What are some of the concomitants? There's unhealthy gums that bleed dark blood, white-coated tongue, foul breath, and constipation. Of course, not everything has to be in your patient, but these are something that we see with creosotum. And there can be profuse bleeding after tooth extraction. So therefore, it is indicated for hemorrhage after tooth extraction. The gums are unhealthy, spongy, and they bleed easily with concomitant swelling of the submaxillary glands. So this is a nice little comparative materia medica. So let's look at a few more remedies. Let's look at calc carb, because it is such an important remedy to look at calc carb whenever we're looking at mineralization difficulties in children. So every type of bone is affected, from difficult dentition, early decay of teeth, to open fontanelles, bony growths, weakness of bones and ankles, chronic back problems. Now you're noticing I'm giving you rubrics. When I give a webinar, I love to give the rubrics because I find sometimes it's hard to find certain ones. Sometimes the wording doesn't match what you think it should be. So I like to give people a head start. Obviously, I can't give you every single sub-rubric associated with it, but here's a very good head start for you. And notice I went to generalities because we noticed that it is so widespread throughout the body that we can go straight to generalities for the bones, the complaints of. Indicated in fistula of the gums leading to the roots, again, the roots of carious teeth, and toothache in carious teeth of scrofulous or rachitic children. So that of course pertains to rickets, which is a disease often seen in children caused by vitamin C deficiency. So you're going to see a lot of imperfect calcification, you're going to see softening and distortion of the bones, and you might even see the child come in with a bow-legged appearance. That'll be a very good tip-off to you. The teeth are carious and bluish black at the roots. I found the bluish interesting because I gave a webinar recently on pregnancy and post-delivery. And when I was looking at breastfeeding in women who needed calc carb, the color of the milk was bluish. So I love seeing patterns in remedies to see, you know, and in this case, the bluish color, both in the breast milk and now at the bluish black color of the root. So we're starting to see a pattern with calc carb. There's that sour taste in the mouth, not surprising. You know, the folds of the chubby calc carb child who has a sour kind of smell in between the folds of teeth, so folds of fat. So sour taste in the mouth with white coated tongue. Now I'm going to talk about Plantago major. It's not a remedy that everybody has heard of. It's one that I learned of as soon as I was learning about teeth. Plantago is the one that came up. It's very much associated with teeth and with ears, and it's very much associated with tooth pain. So let's see how it's associated with premature or rapid dental caries. So there's that toothache. It's the first thing that comes out, but it's also both in sound and teeth with cavities. Okay, the pains shoot through the face and are violent in decayed teeth. So really, really severe violent pains, you might want to think to Plantago right away. There's pain after eating and worse cold air. And it's associated with ciliary neuralgia, which of course is cluster headaches, and also trigeminal neuralgia from decayed teeth. So you can see that the level of the pain that's associated with Plantago is really marked. And it's a cure for aching carious teeth if placed in the ear on the affected side. So this is one remedy that I learned about, that you not only can take Plantago internally, but you can also get the mother tincture and you can mix it up a little bit, and then you can put it in the ear and you can do a simultaneous treatment. Then we have Cytholinum. Not surprising to see some of these more corrosive remedies in you know, premature and rapid decay of teeth. So they decay rapidly, but in this case, the location is at the edge of the gum and they break off and the edges are serrated. And just as a bonus remedy, this is also seen in Thuya. The teeth are cupped in children, and cupping means that there's erosion that forms small indentations or cups in the teeth. The bones are sore, they decay, there's curvature, and there's exostosis. And the children tend to look dwarfed, shriveled up, old-looking babies and children with bald head, pouting lips, and big belly. Now let's look at Mesothelium, okay? The teeth decay suddenly on the side above the gums. The crowns, however, remain intact, and the roots decay. And that he wants to compare with Mercurius, which has crowns that are decayed and the roots are intact. So that's a great way to compare the two. One has the crowns remain intact, roots decay. The other one is the opposite. Now, I will say that if you look up Mercury, teeth, caries, roots you will find it there as well. So you might take it with a grain of salt, but I read a lot of materia medica around this particular rubric, and it is repeated many, many times. But when you do look at the rubric teeth, caries, crown which is what we see here, the crown is decayed, so this is where the caries are. There's only two remedies. One is Staph aureus and the other one is Mercurius. So it is very, very robust for the crown being decayed. Decaying teeth with burning, boring pains involving the bones of the face and the head, temporarily better drying in cold water. Now there is a more specific rubric, face pain, burning, caries, necrosis, and you'll see that I didn't put it in here because this is so general: burning pain, boring pain. You'd love to have a concomitant with it, right? To really help narrow it down. There is this one: face pain, burning, caries, necrosis. There's only one remedy. It's Aurum, and it is also not specific to dental caries. So, you know, if you want to include it in with your repertorization, and then you would just combine these two, then that probably would be ideal. Toothache in carious teeth, which you also see in Plantago, creosote, etc. One of the best remedies for neuralgias, which are reflex from decayed teeth. And reflex, as you probably know, is an action that is a response to a stimulus. Okay, so I've given you a rubric from Borky. Okay, why didn't I? All of my other rubrics for the most part are from Complete, or my version of Complete, which is a pared down version of Complete that's called 4.5 that unfortunately is not available to buy, but it is one that came up before Roger van Zandvoort, you know, really started adding more and more and more remedies to all of his rubrics. So a lot of homeopaths I know like it because it's very clean. So I had to go into Boraki to find this. And this is such a specific remedy. It's got the word reflex in it, and I couldn't find it in any of my repertories. Okay. Also, there is a rubric, teeth pain, neuralgic, caries, necrosis from, again, not necessarily from tooth necrosis. And Staphysagria, again, there is the main remedy. And I did find it incomplete, but they don't mention Meserium, so it's actually missing. And I did go to Complete 2020, the most recent one, and it's not there. So always use as many repertories as you can find, because that word reflex is so specific, and I did find it by doing a complete search of my entire software. All right. Let's move now on to dental pain, which is a very, very, huge topic. And before we get into more details about it, I'm going to give you a very quick case. It's not a complete case, but I want to give you an idea of the kind of questions that are being asked when you have a patient in an acute situation, or it could be chronic. Now, I want to mention, you can see on the bottom, it says case courtesy of Dr. Gary Fortinsky. Dr. Fortinsky is a dentist in Toronto, here where I live. He happens to be my dentist as well. And I did take his course on dentistry, and I did get permission from him to use his cases, because I thought it would be much better to use a dental case than, just tooth pain for many of my cases. Okay, so I just wanted to give him credit for these cases. Okay. The patient arrived complaining of pain in a lower tooth, which started 6 weeks ago, disappearing for stretches, but then reappearing again 2 days ago. So it still qualifies as an acute situation. He suspects a cavity and rates the pain level a 7. And by the way, if you want to open your repertories and start putting in what you feel to be the salient features and coming up with remedies, that would be fabulous. Okay. It is worse cold and motion. The pain comes on slowly, disappears slowly. It is pounding in nature. It is better massaging in the gum area. And the one, of course, indicates the grade, and warm air. The tooth feels loose, but objectively it is not loose, and is percussion and palpation positive. So what does that mean? So the percussion, we know what percussion refers to tapping the tooth, and you can use the back of a fork or a spoon, or you can even use a pen. Palpation, we know palpation refers to placing pressure, but where? Not on the tooth, but on the gums, near the tip, the apex, right? At the top here, at the bottom here of the tooth. Now, if the patient responds with discomfort, we know there is inflammation in the area. Now, percussion and palpation aren't testing the tooth per se, as I said, but not because we're touching the gum, we're actually testing the bone below it. Okay. The tooth feels loose, but objectively it is not loose, right? So looseness, be sure to ascertain whether the tooth is actually loose or if it's only a sensation of looseness, because there are two rubrics, right? One, tooth looseness, and one, tooth looseness, sensation of. So you want to use the correct rubric. He was told, he did an x-ray, so he did ascertain that there was deep decay very close to or just into the pulp space of the second premolar. And he was told that he needs root canal therapy to save the tooth. And we will talk about extraction versus root canal therapy later, so you'll know when to use which. All right. He's worse cold in motion. You can also think to using generalities, jar stepping, if you can get more specific about the type of motion. So be very sure always when the person talks about walking around, get lots of details, go a little bit deeper. The pain comes on slowly and disappears slowly. It is pounding in nature. Okay, I had to go to generalities for this one. You will find one in teeth. It's called teeth pain increasing gradually and decreasing gradually, but it only has 2 remedies, belladonna and stanum. So it's best to go to the generalities for this one. And of course, you can combine them if all the remedies are not in both. It's better massaging the gum around area, and there's warm air. So there's no rubric in the teeth section for warm air ameliorates. I found that very interesting, but there is one for cold air, both aggravates and ameliorates. So we have to go to generalities to find a suitable rubric. The tooth feels loose, but objectively it is not loose. So let's go through some of these rubrics quickly. I'm giving you some of the rest of the rubrics that go with them. The x-ray of the left side shows decay very close to or just into the pulp space of the second premolar, so that we want to include that rubric. So here we can see all of the different rubrics, the symptoms that the patient's giving that are very important to this case. Now, what's missing, of course, is generals. What's missing is mental emotional. So I'm just giving this case as an introductory one. Afterwards, I'm going to give you a much longer case where we're going to really go through so many follow-ups, you won't believe it. Okay. But I will say that staff 1M was given, and the 1M was given because the nature of the pain was quite high. So it was decided to go high in potencies. So here, follow-ups, he left a message saying he has no more pain, he's doing fine. And then 3 weeks later, he said he took the remedy only once. As the day progressed, the area improved and the pain was gone. So clearly it was the correct remedy right from the get-go, except for twice when he had short-lived comfort. Remember not to react too quickly. If the patient regresses a little bit, you can always, revisit the remedy. If you were getting improvement with it, if there aren't any new symptoms being thrown out, don't be afraid to stick with the same remedy. Even if food got into the cavity, he said it was fine. And then, as you can see, even though the pain was gone and the patient was doing better, that doesn't mean that's the end of the case. It simply means that the patient was now ready for the root canal that he actually needed because the pulp was found to be necrotic. Okay. So as I said, don't prescribe a single dose. It generally will not work. Frequency is very important, especially in pain cases. You will need to challenge the vital force many, many times, especially in the beginning. You're going to want to do frequent dosing. And Dr. Fortinsky says you cannot aggravate an already aggravated situation. A lot of people are worried if they challenge the vital force too often that it's going to aggravate. He says you can't aggravate an aggravated situation, and cutting back can also deter healing, and it'll go slower. Okay. Often if you're stuck between two remedies and you weren't exactly sure which one to give, often he'll give the patient several envelopes, usually 2 if he's stuck between 2, 3, even if that's the case, so that the patient will always have the remedy available to them. As soon as the first one turns out it's not working, they'll have the next one available to them. Okay. So I hope you can see here that the homeopathic treatment did not cure the patient of the tooth affliction, right? It helped him cope with the pain and to settle down the area before the required dental procedure, which could not be avoided, could be performed. Okay, it provided relief to the patient. The body did in fact change its response to the stimulus. The stimulus was the pain, the difficulty lying down, the all of those modalities. The body did change its response to the stimulus, but the stimulus was still there, and the cure was not possible due to the death of the tissue that was involved. So it's not likely that you're going to be taking on a case like this very often. You're not the dentist. So I know that for a lot of people, the best thing is to have a lot of therapeutic tips. So I'm going to be sprinkling my talk throughout with those. So the potency that he recommends is 200 or 1M for most pain cases. If you read Dentistry online, a lot of them will say 30C, but a lot of homeopaths don't want to take responsibility for 201. They say go see a homeopath if you're going to go above 30. So, but he's saying 200 or 1M. Just to let you know, I forgot to mention, if you saw Dr. Fortinsky's credentials, he's not just a dentist. He's also studied with Andre Singh in Montreal, and he also has his CCH. So he has a lot of credentials as a homeopath. You will not aggravate an aggravated condition if you are aggressive with repetitions or posology, and you could delay healing. Within 24 hours in an acute case, after multiple repetitions of the remedy, you want to see at least a 30% improvement, and you want to see continued improvement each day and even throughout the day. Very important to keep asking the patient about pain and swelling levels, changing MEs as treatment continues. And one of the best things to do, of course, how do we do that? We ask the patient on a scale of 1 to 10 or out of 100, and then you want to write that down. So every day you can do a comparison of how the patient is doing, if the patient is able to remember. Pain better cold means the tooth is rotting or dying. I found that very, very interesting. So if you have a patient where cold in the mouth, unexpectedly, I would think cold should aggravate, but if cold in the teeth makes it better, it means that the tooth is rotting and dying, and it gives off a gas when it's doing that. And that gas is ameliorated by the cold. So that's why there's an amelioration. So being better cold is unusual because you would expect it to aggravate. Now, soft tissue, on the other hand, is often better cold, right? We put an ice cube on tissue that we have bruised or hurt. That's not surprising. But the outside of teeth, because it's numbing it, right? That's why, and therefore it's not a very interesting rubric. So if the patient tells you I put ice on the outside, it's not necessarily a rubric that I would include, because you would expect that. But the outside of teeth is composed of hard tissue, which is not subject to that same inflammation that soft tissue is. So the amelioration that is brought by cold is very unusual. Pain better warm is more peculiar than worse warm. So warmth can irritate. And pain that is worse in the morning is not necessarily interesting either, because it's been a long time in between doses, and not because it's a modality particular to the patient, right? Especially for the patient who has been able to sleep through the night and has not been able to repeat their dose. If they've gone 6-7 hours without their dose, the fact that they've woken up with worse pain or more inflammation, swelling, does not necessarily mean that they are sleeping into an aggravation. It could simply be because they haven't had enough of the remedy in a sufficient short period of time. So be careful with that one. If previously ameliorated pain returns, the same pain, the tooth has likely moved on to the next stage of recovery, and a new remedy may be indicated. If you've prescribed a simile and not the Cementum, the same symptoms will return. There's no difference between dental homeopathy and any other kind of homeopathy, right? We get an initial amelioration, but then the same pain comes back, then we know we've gotten a simile, but not a Cementum. Even if the swelling is gone, the infection process is still going on. Continue dosing every day for several days up to a week or more. This parallels when your MD gives you antibiotics and they say take the full 10 days. Even after 3 days, everything's gotten better, and they say take the full 10 days. This is the exact same thinking. After the indicated remedy in dental abscess or death tooth, you may need a finishing remedy. Okay, if there is throbbing, give Silica twice or 3 times a day. And if there is no throbbing, give Hepar. Why do I give these 2 remedies? I mentioned them before, because in those abscess, death, those are non-vital tissues. And these are the 2 main remedies indicated for dead tissue, non-vital tissue. If the tooth is dead, neither hypericum nor belladonna is indicated, as they are best suited to vital tissue. And so I just gave you that. The keynotes of a remedy may not apply in the acute situation. That's very important to remember. So for example, you may not see a weeping, timid patient who needs pulsatilla in an acute dental situation. In fact, Dr. Fortinsky says in his experience, they tend to be quite stable, especially the men, and the women may just be a bit more sensitive to pain. So don't necessarily attach the keynotes of a remedy in an acute situation. They may not pertain. Okay, let's have a look at a specific kind of dental pain, in this case caused by abscess. So an abscess occurs when an infection spreads beyond the tooth into the bone, right? So we can go, remember the tooth sticks in this way, so therefore that's where the abscess is. If you're in the mandible, it will go over here into the gum over here. Okay, and it spreads beyond the tooth into the surrounding bone, and this leads to swelling in the mouth. So an abscess is essentially, it's also called a garboil. It's a gumboil, sorry. It's essentially a pimple filled with pus caused by a bacterial infection. And at some point it will drain into the mouth, okay? If a patient tells you that they do have this kind of a gumboil that changes shape, changes size, it's likely an abscess. Sometimes the pus will leave the mouth and go to other parts of the body, even into the chest. So obviously it's very important to deal with it quickly. Now, abscesses can occur in different parts of the mouth and in relation to the tooth, okay? So the first one we're going to talk about is a periapical abscess. So apical means apex, therefore it's occurring at the apex of the tooth, either at the very bottom, the very top, depending on which jaw we're talking about. It occurs at the root tip, and it usually happens as the result of an untreated dental cavity. It could be a tooth chip or crack or prior dental work. Now, a periodontal abscess, on the other hand, starts in a gum pocket. So you can see that over here, and is mainly outside the tooth next to the root. So here you see that there's a bit of space in between, but here it's right next to the tooth. And usually it's gum disease that is the origin. But today we're going to talk about periapical abscess. So here is very quickly the development of that abscess. And because we've studied the anatomy so thoroughly, we can completely understand how this happens. You see the untreated cavity on the left, which allows bacteria to go beyond the dentin. Here's our dentin into the pulp cavity. Here's our pulp cavity where blood vessels, nerves, and lymph reside. So as the bacteria has gone into the dentin here, as the bacteria multiplied now into the pulp cavity, which has lost its healthy pink look, and now it's starting to look dark and necrose, the infection has nowhere to go, right? It can't go through the crown. It can't go through the enamel. So it has nowhere to go but down, out through the root canal and through the apex into the surrounding bone. Okay, and voila, you get an abscess. Now, typical dental treatment is to drain the abscess and treat the infection. So in milder cases, the infected tissue can be drained with a gum incision, and that may be all you need at that point. But the tooth, normally the best thing to do, the worst thing I think everybody wants to hear is I need a root canal. But in fact, the root canal is the preferred treatment because you're going to save the tooth this way. Okay, if the abscess is not too severe and the area can be scraped out, root canal is the treatment of choice. I know that's very controversial. I know there's a lot of homeopaths who don't believe in root canal. We can have a big discussion about that. Dr. Fortinsky will disagree with all of them. His mentor, Andre Singh, he disagrees. Andre Singh says, don't get a root canal. Dr. Fortinsky says it's absolutely fine. Sometimes extraction is required if the abscess is more severe. So that's your least desirable option. But leaving an abscess untreated can lead to serious, even life-threatening complications because it has penetrated into the blood system and therefore it can go throughout the entire body. So I'm going to spend a little bit of time on typical symptoms because these are the things that you are going to be hearing from your patients and you'll know, ding, 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 this could be indicative of an abscess. There's severe, persisting, throbbing toothache that can radiate to the jawbone, neck, or ear. Now, don't be fooled if the pain of an abscess tooth goes away, okay? Especially if you have treated it and the pain goes away and you say, oh, I don't have to treat it now because the pain is gone. It could simply mean that the root is dead, so it needs to be evaluated by a dentist. And the abscess, though, is still very much alive and the infection has not gone away, so it can still spread. Sensitivity to hot and or cold temperatures. And there's all sorts of different rubrics for hot and cold. Dr. Fortinsky likes to take all of them and combine them into one rubric. I'm just giving you a few just to point you where to go. Sensitivity to the pressure of chewing or biting. There can be fever, but it's an inflammatory fever. So obviously fever heat is just a massive rubric, so you try to narrow it down. Swelling in the face and or cheeks. And I like the fact that here I get face swelling toothache from, so I have an etiology. Tender swollen lymph nodes under the jaw or in the neck. Of course, it's not everyone's going to have this. And of course, when we look at neck rubrics, we're going into the back. Tooth feels longer than it is. You get that a lot from patients. They have that sensation of elongation. Change in the pain while lying down. So it could be that it gets worse. It could be that it gets better. It's a good one to keep gauging with your patient as you're doing treatment with them, because sometimes they could be, in the beginning, they could be worse lying down. And then as treatment goes on, it could be better lying down. So you're going to want to take note of that. Restlessness with the pain is obviously, especially if the pain is very severe, but not everybody gets restless with pain. So it's an important rubric. So there are 40 in my repertory rubrics associated with teeth, with abscess of the teeth, but we're going to look at the more prominent ones. And as always, homeopathy treatment cannot take the replacement of proper dental treatment to get rid of the abscess, okay? Unless you can have clear evidence that the abscess has actually not killed the tooth and that it is simply a dynamic process, then yes, you can get rid of the abscess. And if you have proof that the tooth is still alive, absolutely you will not need an extraction or a root canal. This is in the case when the tooth has died that I'm mainly talking about today. But you can use these to try to treat them as well. So in that case, the role of homeopathy is to stimulate the healing process, and it helps the body to deal effectively with the infection so that by the time the dental treatment can begin, it is a less traumatic experience both before, during, and after. So I'm going to give you some of the, I can't obviously go through every single homeopathic remedy. You know the remedies, you know their generals and their peculiarities. And of course, there's no difference here. It applies to them as well. So, and also, even though these are considered specifics because they're so highly rated for this particular disorder, the abscess, of course, you want to take the entire case in order to round out the totality of the patient. So heap ourselves, no surprise there because it's known very much for suppuration, right? So you and pus, and not only for pus formation, but also absorption of that pus. So heap ourselves is going to be a big remedy in abscess and in the tooth as well. So it's valuable in the later stage of abscess when the pus has already formed. The tooth is hypersensitive to touch and to cold air, drafts, and drink. And that's a very big keynote of heap ourselves, worse cold, many things. The gums tend to bleed readily, so you might have that concomitant with the abscess. Hekla lava, which is a wonderful remedy made from volcanic ash from Mount Hekla in Iceland. And I like to read Robin Murphy. He likes to give a bit of a history, so does Hahnemann as well, on these remedies. And Garth Wilkinson was somebody who was traveling in Iceland, and he noticed that in the sheep in the vicinity of this Hekla, that they had immense bony growths on the jaws. So not surprisingly, then Hekla lava is highly indicated in anything to do with bones, and especially with an affinity for the jaws. And where does an abscess occur? In the jaw. So dental abscess of roots extending to the jaw. Bony lesion after a dental abscess. So we see those exostosis as well as dental abscess with swelling, scant pus, worse pressure on the teeth. And of course, there's many more rubrics associated with it. I'm just giving you a little taste of them. Silica, again, not surprising, along with HEPA, very involved with suppuration in the body. But in this case, when you've had the tooth taken out, to help you know maybe what remedy you're going to need, toothache when fibrous membranes cover the root of the teeth and an abscess forms. So the tooth is taken out and you see this fibrous membrane, you know that silica is highly indicated. There is severe pain in the jaw, so it's not just Hekla that has jaw symptoms, of course. Rending, tearing at night, better from heat. These pains often end in abscesses about the teeth, and it hastens resolution of the abscess. That's why Dr. Fortinski always gives silica and Hipar to the patient who's had this root canal with a dead tooth. Merck Sol, abscess will cause, what are we looking for with Merck Sol? Always that, the excess salivation, the foul breath, dirty tongue, pulsating pain. The painful swelling extending to half the face. So in this case, we have more of a specific radiation of the pain. Also note that you can use calendula all the time because it's a wonderful antiseptic. So you can take calendula in a mother tincture. You can put 10 or 15 drops in a quarter cup of water, and you can put a clean gauze pad into it, and you can soothe the area several times a day with it to promote. Once, if there has been any stitching, if it's for another procedure where there's stitching, you want to wait till the ends come together, and it does promote granulation and has antiseptic qualities. All right, so I promised you a longer case. So here it is. I encourage you again, if you want to open up your repertories and follow along, you can have fun repertorizing the case along with me. I'm going to give you a sense of how Dr. Fortinski normally takes a case and just the huge amount of contact he has with his patients that he finds very necessary in order to keep on top of the recovery. So note the date, August 30th, 2010. At the top, I will always give you the date so we can see, how the case is going. And again, this is from Dr. Fortinski. So the patient arrived with swelling and redness of his left cheek of 3 days duration. He cannot eat due to the pain. He thinks the location is the maxillary left canine, which he says died at Christmas time. He has had added stress in the last few months, when his son moved in with him 7 months ago and drained his funds as he helped him through a difficult financial time. He nearly quit his job because his salary was reduced. So lots of financial stuff going on. Pain worse lying down. And Dr. Fortinski, what he does is, because the patient is in his chair, and the dental chairs go up and down, he actually tests it. So if a patient tells you that it's worse lying down, actually have them lie down in your office, or if you're doing a Zoom call, have them lie down to make sure that it's a robust symptom. Feels it's like a heartbeat, so that pulsating pain, and he thinks he is slightly feverish. So that indicates that there's probably an abscess going on. Pain is better ice water on the face. And we discussed before that may not be interesting because the face is made up of soft tissue. Pain is better hand pressure on the area. So you need to go deeper. What is it about the hand pressure? And then as he asked more questions, he figured that it was more when he put the cold compress on there, it was more the coolness on the face than it was actually the pressure. So it may not be an important rubric. Pain is better cool water in the mouth. Not a good sign, as we remember. Remember, the gas is being given off from a dead tooth. Salivation has not changed, and there is no unusual taste. So this is a question you should always include in your case taking. Sensitive to both sound and light. So this is very highly indicative of something alive, something really dynamic going on with the patient. Pain is worse moving around because he feels the banging and jarring. So that rubric was understood that it's not just the motion, but it was the jarring. Now, he might be somewhat depressed since his son moved out, and he feels great stress because he only has $200 to him to last the last 11 days of the month. Again, the financial issues. Still the same day, August 30th. Okay, we haven't moved. On examination, the axillary left canine is percussion and palpation positive. Again, you don't want them to be positive. He said he took phosphorus, so he must have some knowledge of homeopathy, and he thinks it made things worse. He has been short-tempered, and the pain gets worse when he gets angry. So not only do we have an etiology over several months of his feeling depressed with his son coming and then leaving, but now we have this short-term acute ME change where he has been short-tempered with the pain, but not just short-tempered, angry. Okay, short-tempered with the pain is interesting enough, but angry is even more interesting. Patient is told that the upper left canine is abscess. So Dr. Fortinsky did his x-rays and his examination, and the options for treatment are either root canal or extraction, but he opts to save the tooth and has explained that homeopathy will be used to settle the area down before proceeding with the root canal treatment. Okay, so I'm not going to go through every single rubric with you as I did before for time considerations, but we see all of the important ones, the swelling of the cheek. We did ascertain that while lying down, it was worse. The pain was pulsating, so the nature of the pain is important. The cold water ameliorated, that was inside the mouth, not on the outside, right? Teeth, we didn't say that face cold ameliorated, teeth ameliorated. Oversensitive to the light and the noise, the jarring, hurt, anxiety about money has several rubrics in the repertory. Of course, you know that. So this was combined into one rubric. Worse anger and vexation and irritability during the pain. Okay, so Dr. Fortinsky considered all of these remedies, and he thought, given the nature of both the mental and the physicals, the aggravation from the son's visit and from financial worries, for example, he thought that Nux Vom fit best. And because of the nature of the pain and the facial swelling, he wanted to start at a high potency. So he gave him 1M with lots of frequent repetitions in order to, one, we can find out faster if this is the right remedy, and number two, to ameliorate suffering. Okay. So now we're on August 31st, next morning, first thing in the morning. The patient also took Demerol last night and the remedy every hour because swelling increased. Now, this is something that we all kind of go like, with our patients. Remember, he's been dealing with this pain for many weeks and months now. He's used to taking his Demerol every night. So certainly this is our first day of treatment. He's used to taking the Demerol. He took the Demerol again, along with the Nux Vom. He woke up at 3:30 a.m. That's a good indication for Nux Vom, 3 to 4 a.m. aggravation, and felt the swelling had progressed. Better with ice cubes on the area. His whole left side is swollen up to his eyelid. He rated the pain last night a complete and utter 9, completely unbearable. The pain is now better lying down. Remember, before it was worse lying down. So we're seeing some movement, some change, but he still has no taste or changes in salivation. But now he's expressing a desire to run away. He's getting that antsiness inside of him. There's a restlessness with the pain, and he wants to rock around, but that still aggravates, okay? The pain woke him up from sleep, and he cannot stay still for long. He feels comfortable sitting still, but despite the restlessness, and he has worse motion, but jarring is fine. Now it's 9 in the morning. He's made it through the night. He's probably taken some more remedy, and he says the pain is a 2 or a 3. Both his tooth and cheek feel numb. All right. So hopefully you're master rubric people and you put them into your repertorization very, very quickly. Apologies as always for going too quickly. He has a sense of panic and he's anxious because he feels he could have a superbug. So now we add into that a fear for his health. So the question then becomes, did the Demerol antidote the nux vomica? It's a very good question. And Dr. Fortinsky felt no, because the frequency of repetition of the nux vomica would mitigate any possible antidoting of the Demerol. Remember, when the patient woke up, he repeated the homeopathic remedy as well. So this is a very good note for you. Tell your patients if they wake up in the middle of the night, as many times as they wake up, take the remedy again. So this way there is less time in between doses. That's another tip. So because he felt that he wanted to get more complete case, he went more now into the general. So in general, he is cold-blooded. He loves the feeling of taking a hot bath and he prefers a warmer room. He is not an orderly person. So just like Dr. Fortinsky always asks about salivation and taste in the mouth, he always asks about orderliness, especially in a person who's talked about the fact that he's feeling restless, right? Because we want to think to things like arsenicum, who is fastidious, especially in illness. There is no throbbing, and light and noise no longer bother him. He feels calm despite that restlessness. He has been urinating a lot. Here we have an interesting new symptom. He's been urinating a lot and he has the sensation of wanting to urinate, but nothing comes out. Great symptom. He's not had a bowel movement, but he has not eaten much lately. So this is an example of one symptom in this patient, and we're going to have a couple in this patient where we really don't know the etiology of it, and should we include it in the repertorization? And we definitely know that the pain is worse at night because it woke him up at night. So let's take a look at now our new chart. So we still have the swelling of the cheek. We still have cold, but now we have ameliorated while lying, okay? But now we also see some of the mental emotionals. He wants to escape and he's got restlessness from pain, not just restlessness, but from the pain, okay? Motion aggravates, the sleep is disturbed, right? He woke up several times. There's still that numbness in the face. And you'll see that the more specific rubric is numbness of affected parts. Now there's only 7, however, remedies. So we definitely want to pay closest attention to that one because he's giving a very specific area of where the numbness is. But because it's so small, I also wanted to add the numbness one. And I didn't want to combine them. I wanted to see them side by side just to see how they did. But I'm very, very interested in the one of the affected parts. He's anxious now about his health. He's worried that he's gotten a superbug. He has this morbid desire to urinate, but it is fruitless. And again, there's this teeth pain general at night. So now we see that pulsatilla has come up. The nux vom is still very, very strong, but suddenly pulsatilla has taken the lead. It has one more symptom than the other ones does. So he did a bit of a comparative materia medica between these 3, pulsatilla, whether to continue on with nux vom, or maybe it's lycopodium. He didn't want to include belladonna, and if you remember why, because he feels that probably there is an abscess or a dead tooth possibly going on, and belladonna is not indicated in dead tissues, okay? So if we look at a comparative of these rubrics that are missing, we do not have aggravation from motion in pulsatilla and in lycopodium, but we do still have that in nux vomica. However, pulsatilla and nux vomica both have numbness of affected parts, and that's one that we're really interested in, this a really more specific remedy rubric for it, and lycopodium does not. Okay, and he also said that he prefers a cold room. So based on that, Dr. Fortinsky felt that pulsatilla 1M would be indicated. So let's look at the follow-up and what did he learn. So now we're on the same day, but it's 4 p.m. Okay. The patient took the remedy 4 to 5 times and has slept on and off since the morning. That's always a good sign with the remedy, that the patient who needs to heal falls asleep. There is no pain, just discomfort, and he has managed to eat. That's amazing. The swelling is a little softer, so we also have some success with the inflammation. He feels frustrated and very uncomfortable. Okay, we make a note of that. That's fine. His cheek is a little more flushed, and he feels that this, however, is the correct remedy. And he's had an appetite and he thinks the swelling is down. So this is a very, let me see if I have any more. No. So let me just go back for a second. So this is a good example of a case where the first remedy lays bare the next remedy, right? In this case, more of the Cementum. The nux vom was more of a simile. This is more of a Cementum. It brought up new symptoms that will point to the Cementum, okay? But even with that, Dr. Fortinsky said he wasn't still 100% sure that lycopodium, he wasn't going to hang his hat on the fact that inflammation of affected parts, numbing of affected parts was not in lycopodium. Okay, because things can be missing in the repertory. So he sent the patient home with both pulsatilla and lycopodium. And if the patient hadn't responded well to pulsatilla, he would have had the lycopodium right away. So in terms of your protocol, what is important for you to do in terms of follow-up? So as you can see here, there is a lot of frequent follow-ups to minutely track how the patient is doing. So follow up a minimum of 6 to 12 hours after the first dose of your remedy, if possible. And if you give it later in the day, first thing the next morning. So by then the patient will have taken about 4 to 5 doses of the remedy. So you can really gauge pretty well if they have responded to the remedy. And then as symptoms ameliorate, you can space out the follow-ups and as well the dosing. Okay, you want to determine the correct posology. You know, always a problem with us. Do we have the right remedy but at the wrong posology? Okay, so pay very close attention to, the pace of the recovery, what is being recovered. If the symptoms remain the same, but there is slow improvement, you're probably on the right track. You probably need a higher potency. If the pace is slow, but there are new symptoms coming up, probably need to retake the case and give a new remedy. Okay. By 8 hours after giving the remedy, with many repetitions, you should know if you're on the right track. The pain will be diminished, the swelling will have gone down, et cetera, et cetera. And you should really start at a minimum of 200 C. Sometimes people like to say, I like to start at 60 or 30 C because then I have room to go up. But you're really dealing with a very painful situation. And please don't let your patient suffer. Start at a higher potency. For sure, 1M start with if the aggressivity of the situation is severe.
Hey, Robin.
Yeah.
Sorry to interrupt you, but this is just, you have 10 more minutes to speak and we will take, if you don't mind, 5 to 10 minutes questions. Is that okay?
No.
you can go ahead for 10 more minutes and then
I'll
we
go
will
for 10.
Please,
Okay.
Please. Thank you. And we will bring you back again. It's very interesting. Thank you.
All right. So I'm going to make an executive decision what I'm going to teach to you. So we're going to go quicker through this. Unless if Kavitha, if people are saying I want to go through this case more fully, I'll continue, but otherwise I'll go quickly. I think you got the gist of what it is. I think you get the sense that he's doing very...
Robin.
What's that?
Please. Yeah, sure, definitely. If anyone wants to go in depth, please go ahead.
Well,
please continue.
Okay, so you could just see that okay, so I'll finish the case then. So the pain has been more in the upper cheek. So we're still on the same day. He's called him in the evening. He feels there's more swelling and has a headache, worse lying down. He's in a grieving mood. He starts to cry. He says he misses his son. He wishes he had company. He feels sorry for himself. He's disappointed that he didn't get the raise as quickly as he was hoping to. And lying down makes no difference in the tooth pain, nor does walking around. He still feels numb. And he was also accused of undercutting a coworker. He got an email and he felt angry as a result. So the question is, do we switch the remedy at this point? We've gotten a few new symptoms. Have some symptoms pointed to a new case, to a new remedy, or is there something to contraindicate the current one? So here we can see that many of the symptoms are the same. That hasn't changed. But now we see in the bottom, okay, ailments from disappointment and deception, ailments from grief and sorrow. He's missing his son. Ailments from anger and vexation about that email that he got, and he wants company. So we create a new totality, tacking on the old symptoms that still are there, and we still see that pulsatilla isn't indicated now. But because the phone call took place at 7 p.m., there isn't a lot of time left at the end of the day. So Dr. Fortinsky recommends if you're talking to your patient late in the day, have them repeat the remedy more frequently. In this case, it was every half hour. And this way you get more repetitions in before the patient goes to bed. That's a really great tip. So still the same night, 10 p.m., he feels bloated all the time. Well, we don't know what that's about. He feels no pain, uncomfortable. He's now taking it hourly. He said the headache is the same. Remember, we did have that headache before. Again, we did not repertorize it because we don't really know what the origin was. There's pressure from swelling is down 50%. Mood is better. He's not crying and his voice sounds better. Okay. So just note the number of phone calls. He spoke to him at least 4 times this day, but the phone call can last all of 5 minutes. Okay. It doesn't have to be a big deal. Just gauge how your patient is doing, make a quick determination. Okay, next day in the morning, the patient reports that he's improving. The swelling is down 20% and he had a good sleep. He woke up to urinate with the remedy each time, so that's starting to resolve. The pressure has further reduced. He was able to sleep on his left side, which is new. So we're starting to see everything is starting to resolve. Here we are at 11 a.m. the next day. Inside his mouth, he cannot feel a lump next to his tooth. He can eat better. He went for a jog. So definitely the patient is getting better. The swelling has continued, has continued to shrink. Sorry, he took the remedy 4 times. So again, even multiple days into this, repeat. The headache is gone. What was the headache about? Should we have used it in our repertoires in short? No, it turns out he wasn't drinking coffee and he thinks it was related to the caffeine. So that can take you down a rabbit hole when you start sometimes with these new symptoms. So, when a patient says, I have a headache, try to ask them as well, these, lifestyle and other things that might have precipitated it. So you don't make sure you don't use the wrong rubric. He's taking supplements, and it's very good that the patient is telling you that they're taking supplements because some of these are medicinal in character, and you don't want to interfere with the treatment. Okay, and Dr. Fortinsky really feels that homeopathy should take care of all the symptoms and really encourage your patients not to take supplements. He also had that upset stomach before, but lo and behold, look what he was doing. He was taking vitamin C 5 grams 5 times a day, slow release. So that precipitated the bloating. So the very next day, at the end of the day, he is almost back to normal, 95% less swelling. He only has a sore spot. He's cut down on his vitamin C and on his supplements. So now very interspersed now the contact by September 7th. He says he's 100%, but he says there's just a little sensitivity if he pushes on the area. He can eat normally now. He has not taken the remedy today and did take it 3 times in the last 2 days. So the question is, it's 100%. Have we done our job? No, the fact that there is still some sensitivity in the area indicates that he's not quite 100% healed and that there's still infection in the bone. So the next day, root canal was performed, 1 canal, and it was found to be necrotic. So it was dead. It did need to come out, and he was given silica after the procedure. So here, take a quick screenshot of some dental pain remedies there. In my pared down repertory, there's 326 remedies for dental pain. In the current complete, there's 598. So I've just given you some of the ones that you might be using more frequently. Both MagCarb and Staph are associated with tooth pain around menses. So that's very interesting to tease out if you have tooth pain at a certain time in the patient's life. Okay, so let me see. I'm going to have to let's do a little bit of mental emotional, because that is something that you will probably have to deal with since you're not dentist. Let's say you're not going to be doing any procedures. So let's do a little bit on mental emotional, because it's not just for dental surgery, but it's also for going into the to a dental appointment. Okay, the first one to think of is always aconite, right? Great fright, even terror before the surgery or just visiting the dentist. They predict they will die from the procedure. So the protocol is take it a night before and upon waking, repeat after surgery if the feeling persists. And there has been research done with aconite and on children, and it did find that in 95% of them, giving it to them did ameliorate all of the fright around the procedure. In gelsemium, there's great anticipatory anxiety. We know that very well, but there's weakness and trembling before the surgery or the procedure. There's fear of doctors and dentists found in the Materia Medica.
She shouldn't sleep.
Sluggishness of the body, mental prostration, and diarrhea with the anxiety. That's a keynote of gelsemium, diarrhea with the anxiety. Take it the night before and upon waking, and repeat after surgery if the feeling persists. And then I put next to it argentum nitricum on purpose, because both gelsemium and argentum nitricum both have that anticipation and apprehension about upcoming events. And they both have the diarrhea with the anxiety. But the difference with the gelsemium is they're that dopey, drowsy feeling, whereas with argentum nitricum, they're worried and they're hurried. And so that's a good way to differentiate. Chamomilla, of course, for the, especially, I mean, you see it in adults too, but with the children who are screaming in tantrums and they don't want to go, I'm not going. They even, in one case I read, they hit the dentist in the face, if you can believe it. So if you're getting that kind of reaction, that capriciousness, give me, and then throws it away, give the night before to help with anxiety and sleeplessness before the surgery. And I would definitely give it in the morning as well. Pulsatilla, there could be that crying, the clinginess, I don't want to go, don't leave my side, I want to sit, you have to hold my hand through the procedure. So that's a very good remedy for that. And then there's calc carb, which a lot of children need. There's intense fear of pain and suffering of the physician, especially dentists. You'll have the fear of injections and of surgery. And you'll see a very interesting way to differentiate is the children can be very obstinate at home, but then when they go outside, they can be timid and fearful. So if you see that kind of change in their behavior, you might be an indication for calc. Okay, so I'll go quickly through. These are just all, take a screenshot if you want, but all you have to do is go to your repertory and put in extraction, teeth and mouth, and you'll find these are the rubrics that go with it. Not surprisingly, arnica is number one because it is like an injury, right? You're pulling the tooth out. So I'm going to give you quickly a protocol because I think protocols are probably the most interesting for us right now. As soon as the extraction is done, drop 1 pellet of arnica 200C under the tongue on the other side of the extraction. Now you'll notice that I didn't start this with the night before the procedure, give arnica. And the reason I'm not including that is that from listening to Dr. Fortinsky, who's done thousands of procedures over multiple decades, he has said he has found no difference, even though you read it online all the time and all, give it before. He said he's found no difference giving arnica before. If you give it afterwards, it's plenty. Repeat arnica 200, and of course, sometimes you might need to do 1 m if the pain is severe, every hour after extraction until the freezing is gone. Do not repeat unless there is pain. If there is pain, take 1 pellet every hour until the area settles. You might have to do it more frequently until you can space out. Regardless of how the area feels, this is important. Repeat the arnica 200 before bed. So if your patient says, I was feeling great, I didn't feel like I didn't need it, I must be getting better, insist to them that they take the arnica before bed. And the same thing, repeat it no matter how it feels, repeat when they wake up in the morning, and then you can repeat throughout the day. If the remedy is not bringing relief, then take an acute history. Also, don't forget Hypericum is also highly indicated in these situations. Ledum is indicated if there is pain around the injection. Hypericum if there is nerve pain. Don't be afraid to alternate Hypericum and arnica. So here it is, other remedies to consider. Hypericum due to the high nerve content. You can alternate Ruta, which is considered the arnica of the periosteum due to ligament damage. Also, anatomists consider teeth to be a ball and socket joint, if you can believe it. So Ruta is good for many issues associated with the extraction, both the periosteum and the fact that it's next to the periodontal ligament. So it can take care of both things at the same time if there's any inflammation or difficulty around that. Ledum due to the puncture wound, pyrogynium if there is any kind of that really active infection going on, lots of sepsis and smell, for example. And Staphysagria is very good for dealing, if there was any dental surgery where there was an incision, you might want to consider giving some Staphysagria as well. Now the patient might want to take a painkiller, and Dr. Fortinsky says that's fine, and generally he finds, let them take their allopathic pain reliever, and usually that along with the homeopathic medicine, after the first one, they find that they don't need it. To repeat the allopathic one. How am I doing on time? About 5 minutes. So I'm gonna go quickly just through hemorrhage, because you will see hemorrhage that does occur and they might come to you in the office. So as always, whenever we're considering hemorrhage, now this is not hemorrhage that is just the normal bleeding that occurs with a procedure. It's one that is profuse and prolonged. So if it doesn't go away, one, you have to ascertain if there is a chronic condition going on. There could be von Willebrand's, there could be a clotting issue, there could be other things associated. So this is a chronic issue that needs to be addressed. But if you have a patient who might have, for example, knocked out the blood clot that was formed in the pocket, for example, and bleeding persists, you're going to be called, how can I stop this bleeding? So we always want to ask certain questions when we're assessing hemorrhage, right? What is the color of the blood? Is it dark or bright? How much amount is it? Is it scanty or profuse? What is the flow? Is it oozing or is it gushing? Is it changeable? Does it start and stop and start? And are there any concomitants, right? Sometimes there'll be nausea with it. Sometimes there will be smelling with it. Sometimes there'll be convulsions with it. So those are extremely important ways to narrow down the remedy. So I'm just going to unfortunately have to go through this very quickly. So if you can take a screenshot if you like. So arnica is number one. That's the first one you want to go to. And you have to continue with it for multiple days. Phosphorus is also the first one we think to, but from what I read, you want to start with the arnica because it's very good for the ecchymosis and the bleeding. Then you can think to phosphorus with the bright red blood. And then if that doesn't work, you still have bright red bleeding and it's continuing. You want to do this protocol. You want to create this in a solution before you go to the office so that you don't have to make it on the fly. In this case, China with phosphorus and ferrum phosphoricum for this unstoppable red bleeding. And if that doesn't work, you might want to think to ipecac and millefolium 30. And also think to lachesis, right? You don't always have bright red blood. You might have a persistent dark bleeding. And also think of cinchona, no surprise, worse from loss of bodily fluids, in this case, hemorrhage from the teeth, and it's accompanied by blurred vision, buzzing in the ear, weakness, and a desire to be fanned. So I was going to do root canal, and we're going to have to not do that. So these are the causes of it. I hope this is not annoying to people watching me do this. This is the procedure. This is how it's done. So now that we've studied the anatomy, we know that a hole is made through the top, files go into the root and they're cleaned out. And then a dental material called gutta percha is put in. There could be a temporary filling that's put in and then a full crown is put in. So that is what a root canal is. We know the anatomy, we know exactly what happens. So the typical symptoms, severe pain, referred pain, tooth discoloration, swollen or tender gums, deep decay or darkening of the gums, inflammation of the gums. I feel so awful doing this so quickly. Lingering sensitivity of hot or cold, inability to sleep due to the pain. We saw that a lot of these with our previous patient. Tooth mobility, whether it's actual looseness or a sensation of it. This is the elongation one. Sometimes they feel that the tooth feels larger. Foul breath, and spontaneous toothache. All right, so I'm going to end. I am at the end of mine, Kavitha, Dr. Kavitha, I am at the end. So I'm just going to give you some tips. I do have two handouts that hopefully Dr. Kavitha will be able to mail to you. There are two research papers that covered just all sorts of situations from A to Z on dental situations and some quick and dirties about what you might want to think too. So that hopefully will be sent to you. But here are some dental procedure protocols and tips that I want to leave you with, okay? Puncture wounds, we talked about. Leadum is very good. You can start dosing 3 to 4 hours before the appointment. Only use, though, if suffering from injection, okay? Don't give to somebody who doesn't typically suffer from injection. You can also think to hypericum. If there's a gagging tendency, that's an interesting one. You can take either aconite or agaricus, okay? Or you can even alternate. One dose every hour, starting 3 to 4 hours before the appointment, and you can alternate. And here's a natural treatment. Tap the temples and say, you don't want to gag over and over again. So it's kind of like a positive affirmation, telling yourself, you don't want to gag, or I am not a gagger. I don't need to gag, that kind of thing. Freezing, here's an interesting one. Chamomilla is both good for hastening freezing and prolonging freezing. And also, once the procedure is over, you can take it again, and it will reduce the time it takes for the freezing to disappear. Question frequently asked, can I give silica to my patients because the fillings will fall out? The answer is no. Silica at X potencies, remember we're giving silica starting at 200 C. Silica at X potencies may cause expulsion of splinters, however. We talked about a protocol for anxiety. You can also, I'm a classical homeopath. I don't always recommend taking things at the same time, but I'm okay with alternating. So you can alternate aconite with chamomilla if you're not sure which one will work. One of them will work or both of them will work. They might work to enhance each other. If you have injuries to the teeth, something we didn't talk about today, obviously the first one to think about is arnica and or hypericum. You might want to alternate. Never change remedies as long as improvement is occurring and the symptoms remain the same. Remember, you might need to make the potency higher, but don't change if you're on the right track. And supplements are unnecessary with the correct homeopathic treatments. So I wanted to show you that there is research on homeopathy. I'm giving you 2 pages worth of it. Very easy to just go on Google and say homeopathy research dentistry, and you'll find these. And here are some of the references that I used today. I used a lot more than this. Obviously, I used a lot of Materia Medica, but I think I'm done. Did I do okay, Dr. Kavitha? I might be 2 minutes over.
You did it, Robin. I know there is so much. And first, I would say thank you so much. This is a wonderful presentation. It is thorough. You have covered everything, all the dental issues in detail with differential diagnosis and rubrics. No words to say. And we will take some questions, Robin. Dr. Sweta, please.
Thank you, ma'am. We have one question. Can remedies treat or cure deep periodontal pockets?
Deep, like
Periodontal
dry socket? Dry socket or deep pockets?
Yes, periodontal pockets.
Yeah, so I didn't study gum disease for this, and I'm not a dentist, so I'm really afraid to say anything that I don't know. But we can extrapolate from everything that I said today, okay? If the area is inflamed, and it is not due to necrosis of the tissue, if it's not due to something within the tooth that has died, then definitely we can treat it. And definitely we should treat it before we do any kind of periodontal surgery, okay? If it is, however, due to dead tissue, I think there's only so much that we can do.
Any more questions from the audience?
My webinars are notorious for no questions. So.
There's one more question. Can you treat dental erosion?
Dental erosion. Well, okay. Yes, not homeopathically. If you're having any symptoms as a result of the erosion, okay, then we can deal with it. There are two issues around dental erosion, I would think. One is lifestyle. What is causing the erosion? Obviously, there's some bacterial process going on. So you need to change your diet, you need to change your hygiene, and you need to also see if there is a chronic issue, a chronic disease within you that is causing the dental erosion. We can treat all, we can deal with those. However, we have to see how deep the erosion is, right? If the erosion is still at the level of the crown, it hasn't gone too deep into the dentin, right? Then obviously what's going to happen is you're going to have some dental work where they're going to build up the tooth and they'll create a crown around it and they'll fix it that way. Okay. If it has gone into the dent, into the root cavity, and it has gone into the pulp, and we're starting to see signs of necrosis, of death of the tissue, then at that point, you're going to have to deal with it with a root canal and or an extraction. So that's, a great question, because if you're having erosion, there's stuff is going on inside of you, whether it's related simply to the tooth or if it's a sign of a general disease within you, you need to figure that one out. And you need to stop the erosion as quickly as possible so it doesn't go deeply. So that's lifestyle.
Thank you. And for me, it was a wonderful webinar, and you have elaborated each and every point and all the things from dentistry. And over to you, Dr. Kavitha.
Dr. Sweta, and someone in chat have raised the hand, Dr. Gaur. So would you like to, we will take one or two questions, please. Yeah, please, would you like to speak? Hello, Dr. Gaur, you are unmuted.
Yeah, speaking. Hello. सुन पा रहे हैं? Hello.
Do you have a question, please?
Nothing. Thank you. Oh, thank you.
Okay.
Dr. Kavitha, I do see another question from Pinky Kang that I can address. So can we use the indicated remedy for applying on the tooth? Does it help? If yes, is it the same potency? That's a great question. And the only time that I've ever seen that is in the case of Plantago, which you would use in mother tincture. And I would also use calendula in mother tincture as well to help with healing process and as a natural antibiotic. But you raise a really, really super interesting question. So just as we know, if you get a burn, right, and you can take Staphysagria, let's say Staphysagria is indicated, and you can take it internally. It's also suggested in the Materia Medica that you take the Staphysagria in water, you take a clean cloth and you can put it over the affected area. So I see no harm whatsoever in taking the same remedy, and the same potency is fine. If you're a little afraid, go lower if you want to start, and put it into solution, and then put it over the affected area and see what happens. You know, Hahnemann, we wouldn't have homeopathy today if Hahnemann did not experiment with cinchona, right? So be pioneers. Remember, you're not going to aggravate yourself. And if you do, dilute it more and take another dose of it, so you'll antidote it, but experiment on yourself. I mean, I don't think it's going to hurt, and it might actually help. And then you can come back, bring back your research findings here, and we'll learn what you learned.
Thank you, Robin. And everyone, whoever is watching on Zoom, they can get the link in the chat. Dr. Sweta has posted. Please get that link to get the continuing education certificate. And if you are on the Facebook, please do email us to castedygroup@gmail, and we will provide the link. And please do it within 1 to 2 days. That way we can send the certificate. And so we have Professor Regina here, and also Dr. Deepak. We would like to ask them any questions or anything. Please, Professor Regina, would you like to say?
Yes, please. It was an awesome webinar, Dr. Robin, and I was particularly interested in the abscess, periapical abscess. It's the most cases that come to my office, and they suffer so much, and it was very enlightening. I thank you from the heart. I won't forget this webinar. Many blessings.
Thank you kindly. That's lovely.
Thank you, Professor Regina. And Dr. Deepak, would you like to have anything?
Yes. Thank you, Robin, for this wonderful lecture. And you started from the anatomy of teeth to the pathology and to the treatment. This is really wonderful, and you explained the medicine very well. But we know the homeopathy is limitless. So we are adding a few remedies for your dictionary. Number one is Calcarea hypophos, and I am using it in 200x potency for the tooth decay. This is really doing amazing in 2 or 3 doses. This is a wonderful remedy. Next one is acid muriaticum. This is also a wonderful remedy. Next one is aurum metallicum and phosphorus. These 4 remedies are having the immense effect on tooth decay, and especially in the old ages. So I am using phosphorus in the old age, aurum in the old age, and calcarea phos and acid muriaticum in every age. So these are 4 remedies from my side. This is really wonderful learning from you. Thank you so much.
Thank you. That's fabulous. I'll put that in my list. Thank you so much.
Thank you, Dr. Deepak. And I know since we have so much to say, and we have covered in 2 hours because we blocked for 2 hours, and we will bring back Robin again to our webinar. And any questions, please email us and we will answer. So we would like to take privilege to honor your gracious presence and precious time, Robin, and sharing your knowledge and wisdom with our caste certificate. Please kindly accept. Dr. Sweta, would you like to share, please?
Oh, how lovely. Thank you. I will cherish that. Thank you so much. And thank you. I was, Dr. Kavitha and I have been going back and forth all week. And I said, oh, what am I going to do? It's so long, my webinar. So because I was in rush mode, I was in Argentum nitricum mode. I didn't get an opportunity to say thank you to Dr. Kavitha. Thank you to Professor Regina. Thank you to Dr. Shweta. Thank you to Dr. Deepak Sharma. Thank you so much for inviting me and for giving me the honor and the privilege of creating a webinar that was of great interest to me, and of sharing my meager knowledge and my continually growing knowledge with all of you. So thank you for the opportunity.
Thank you so much, Robin. We already received the testimonial from you, which we have kept it in the website.
Okay.
Thank you. That was so beautiful. And also we would like to take a privilege to honor Dr. Deepak Sharma on behalf of Dr. Yudhishthir Singh, President of DHMA. Please kindly accept the certificate from our team.
Thank you, Dr. Kavita, and thank you, Dr. Shweta, for this wonderful certificate. Thank you so much. And thank you from entire team of DHMA to the entire team of KHA. Thank you.
Thank you so much, Dr. Deepak. And let me announce the upcoming event on September 19th, 2021, at 9 o'clock India time and 11:30 a.m. Eastern. We have two speakers, Dr. Vandana Chopra and Dr. Pankaj Agarwal, on topic research-driven quantitative and qualitative approach to study homeopathic literature. And we have many more renowned homeopaths lined up for our KHA webinars. And once again, I thank KHA Homeopathy Study Group entire team for the continuous selfless support, and so that we can make all these activities and beautiful webinars. Today, we have with us KHA volunteers, Dr. Hiralal Agarwal, Dr. Srija, Dr. Nupursha, Dr. Lakshita, Dr. Mamata, Dr. Shravani, and many more. Dr. Bhavana Gurraj, and many more watching on live on Facebook. So, and thank you all to all the homeopaths who have joined from different countries, United States, Canada, Brazil, India, Australia, New Zealand, for their precious time and undivided attention, because I know it is 10:30 p.m. in India and you have to go back to work tomorrow morning. So anyway, thank you so much, and thank, as always, thank universe and all the dignitaries of KHA speakers of our webinars. Thank you so much. And Dr. Sweta, would you like to wrap up, please?
Thank you, ma'am. And first of all, I would like to thank our speakers for their gracing our KHA platform and extending their precious time. And I want to thank our audience for their precious presence, and we have a lot more such webinars in the queue. So for future updates, you can follow our social media platforms like FB, Facebook, Instagram, Twitter, and LinkedIn. For the webinar videos, you can follow or subscribe our YouTube channel with the name Kavita Kukunur. And if you have any query, you can reach us at kstudygroup@gmail.com. Thank you all for joining us today.
Dr. Sweta, thank you, Robin, and Dr. Deepak Sharma. We will have you again at our webinars.
Thank you so much.
much. Thank you.
Cheers.
Cheers, everybody.
Dr. Sweta is going to play music.
Thank you, everyone.
Thank you all.